After Israel set the bar with vaccine boosters for the elderly, other nations are starting to follow suit. The British government reportedly told local media that it intended to give a third dose of the coronavirus vaccine to patients above the age of 50 as early as September 6th. Meanwhile, Germany has also drafted its own proposal to give boosters to the elderly from September 1st.
That is the indication from UK government that they wish to combine the seasonal influenza vaccine with the SARS-CoV-2 vaccine booster as well, starting from the older age group.
The logic behind the decisions is the same across all nations. Governments worldwide fear the rise of the Delta variant makes vaccines less effective. Israel and Britain have seen very different results in vaccine efficacy against the Delta variant. Israel's health ministry said the current vaccines are only 39% effective at preventing Delta, whereas British authorities say they have been 88% effective.
The Pfizer vaccine globally has been found to be very effective. So for Israel to have found that the efficacy was as low as you mentioned is, I personally think, an artifact or something unexplainable, because in other parts of the world, the Pfizer vaccine has been extremely good.
Most doctors agree that whatever the efficacy is in preventing infection, the vaccine is still very effective at preventing serious infection. The question is a third dose the answer?
What I would like to see are the data that would validate the idea of giving someone a booster. Right now, if you look at the studies that are available, and probably we're going to get a lot more data from cohort studies that the CDC has been following.
A third dose has not been approved by the U.S. Food and Drug Administration, nor is there any clear long-term data about its effectiveness. On the other hand, if vaccines have so far prevented serious illness, then shoring up immunity should theoretically continue the trend. Pfizer itself claims the immunity from its vaccine drops to 83% within 4 months of vaccination, and has said a third dose will be needed. These, alongside earlier statements, have prompted congressional inquiries into the company's research. A booster within months of initial vaccination is exceptionally rare for any virus, and more countries than not are still questioning if this one is necessary.